It is well established that the threshold for a pathogen to be identified as contagious or infectious is a secondary attack rate of at least 20%, and to be highly contagious, as both Northam and Fauci claim COVID-19 to be, the pathogen must exceed a secondary attack rate of at least 60%, and, since the 1980s, scientists within the medical research community have determined definitively that to set off a superspreader event there must be pathogen that is highly contagious, and that merely an infectious disease like even the flu is insufficient. This is an important point for you to remember, Mr. Phelps. Generally, in both the social sciences and natural sciences, the authority of large sample size studies are considered sufficient to produce a normalized random distribution curve. However, apparently, even medical experts at Johns Hopkins University, one of the nation's leading medical research institutes, is uncertain, after examining a review of case studies that had found attack rates varying widely across countries and case studies, with the lowest reported attack rate of just 4.6% and the highest as 49.56%, which attack rate, for purposes of guiding public policy, is the proper one to assign to this deadly pathogen. According to one study, conducted in Japan, in March, involving only 313 laboratory-confirmed cases, the attack rate, designated as R, was very low, only 7.2% with a 95% confidence interval amongst males children between the ages of 0 and 19, and only 3.8% amongst female children. In this sample of only 313 total cases, the peak R, or attack rate, was seen in those aged from 50 to 59 years, both for male, 22.2%, with 95% confidence interval, and female, 21.9%. Would you be willing to bet the fate of the world on only 313 laboratory-confirmed cases, Mr. Phelps? One study in Ontario, completed in May, focused primarily upon the topic of infection fatality rate, which was estimated to be approximately 2.8%, found that, while the estimated attack rates in persons 80 and older were 4 times higher, the average attack rate was found to be less than 1%, after examination of almost 23,000 laboratory-confirmed cases. Less than 1%. Certainly, 23,000 laboratory-confirmed cases is a very large number, Mr. Phelps, but according to this large sample size study, not only has COVID-19 found not to come close to the 20% secondary attack rate required to be determined as a contagious disease, but also the secondary attacks in this large sample size study are almost non-existent. In another study, conducted in Taiwan, focused upon determining at what point after infection patients were found to be most infectious, it was determined that the secondary clinical attack rate was only 1.0% among 735 contacts whose initial exposure occurred before symptom onset in the index cases, and that none of the 852 contacts exposed 6 days or more from symptom onset developed COVID-19. That study further noted that in mainland China, the attack rate among household contacts was found surprisingly low, identifying specifically one prior study conducted in China, in which roughly 1,300 close contacts of some 400 COVID-19 cases were tested, and found only 11% of household contacts became infected, and yet noting that the finding of no cases of transmission occurring at 6 days or more from symptom onset is consistent with data showing decreasing viral loads as the illness progresses. This study, Mr. Phelps, probably also would fail for public policy because even with as many as 1,300 close contacts for 400 COVID-19 cases, the secondary attack rate failed to attain a level of 20%. In another study, involving one church, in Arkansas, at which, among 92 attendees at several services from March 6/11, a total of 35, or 38%, developed laboratory-confirmed COVID-19, and 3 persons died. In this study, it was found that the highest attack rates were not amongst persons aged 65 or older, but rather among persons aged 1964. Certainly, Mr. Phelps, in this outbreak in a place of worship, with secondary attack rates ranging from 38%, but would you be willing to bet the lives of the world on just 92 cases with aberrant findings? Mr. Phelps, it is important to note that, in February, after the World Health Organization office in China had alerted the world regarding the emergence of a pneumonia of unknown etiology in Wuhan, completed a joint mission examination of 55,924 laboratory-confirmed cases reported as of the 20th of February, 2020, with a median age of 51 years, with the majority of cases, 77.8%, aged between 30 and 69 years. Among reported cases, 51.1% were male, 77.0% were from Hubei, and 21.6% were identified as farmers or laborers by occupation, in the 42nd largest city in the world, and the largest city in the central mainland of China. According to that report, China had a policy of meticulous case and contact identification for COVID-19. For example, in Wuhan more than 1,800 teams of epidemiologists, with a minimum of 5 people /team, were tracing tens of thousands of contacts a day. Contact follow-up is painstaking, with a high percentage of identified close contacts completing medical observation. Between 1% and 5% of contacts were subsequently laboratory-confirmed cases of COVID-19, depending on location. And, based upon this finding, along with the high correlation of infections associated with clusters, the World Health Organization found no evidence to support the conclusion that COVID-19 was a contagious, much less highly contagious, disease. Mr. Phelps, this large sample size tracer contacts study may be significant and authoritative simply because the sheer size would have been expected to assist in regressive analysis, providing a normalized random distribution curve. However, these findings of a secondary attack rate of less than 5% were confirmed yet again, in the largest sample size tracer contacts study to date, involving over 3 million laboratory-confirmed cases in India, that found a normal secondary attack rate of 4.7% amongst most age cohorts, but finding a rise in secondary attack rate against persons over the age of 65, but only at a rate of 10.7%, almost half of the threshold for a determination that an infectious disease exists. The fate of the world is in your hands, Mr. Phelps. This tape will self-destruct in 5 seconds.
This advertisement was authorized by Mike Webb.